For the past 8 years, the All Kenyan Moot Court competition has been keen on pushing the conversation on human rights within the Kenyan context. Through conducting various moot court competitions centered around human rights issues happening in Kenya, we've been able to engage with various stakeholders and, most importantly, law students from across the various universities countrywide to steer human rights discussions among students. This year will not be any different. Even with the COVID-19 pandemic that has changed what would be the old order to what is the new normal, we will hold our conference and moot court competitions to push the conversation around health and corruption, with a key focus on the Article 43 right, its realization, government response to the COVID-19 pandemic, and the malignant cancer of corruption that has over the years crippled the Kenyan healthcare sector. Join us virtually from the 2nd to the 5th of June 2021 as we discuss the theme, Combating Corruption in the Attainment of the Highest Attainable Standard of Health. All are welcome.
During the COVID-19 pandemic, what has been your observations as MT in this regard?
Thank you once again. I think it is what Harriet has asked. Indeed, I think any key concern for a taxpayer in Kenya, considering that paying tax has always been, a challenge. Everyone feels the pinch, but within the COVID period, the pinch has been felt by individuals, households, and businesses more significantly because, of course, economic activities have peaked, but the government still expects that income as people behind the priorities for the country. So first will be an appreciation to all taxpayers that are listening to this and every other that generally right now tax compliance is something that government must appreciate. But we have also seen within this period study that entities, media, oversight institutions have pointed out that in spite of that sacrifice made by citizens, we still find that there are instances that were pointed out as areas where there was leakage, areas where there was not efficient procurement. So I think this is an issue of concern. And as you mentioned, having worked as an institution at Marriott over the years, a concern has been that the sectors that are generally relied on more by the marginalized groups, because as a nation we obviously need to appreciate that people and households are at different levels, but there are fundamental sectors whose contribution to the economy and their contribution to both national and even international goals is paramount, such as education, such as health. So these are areas that we have seen over the years kind of neglected and a lot of influence is on infrastructure. But with COVID-19 we have come to acknowledge that we cannot ignore some of these social sectors because they do have a great impact to the nation. So one, as we say, the reservation of our budgets and priorities is that in the recent past priorities are shifted to infrastructure. So the human development indicators have been fairly as well. That is particularly at national level. So we also need to interrogate what happens at county level, because remember, some of these functions that we are starting to do have been developed. So there are core functions, and particularly for COVID-19, I think the other important aspect of growth is the intergovernmental relations. So management of a pandemic, or one of these is a function that appeals to both levels of government. So how has that coordination been? That is something that the lessons from these management be able to inform how these levels of government coordinate better. In terms of priorities, as I say, we all have to look at county level. Of course, we have to look at their budgets to see what their priorities. So we wouldn't be able to speak to generally all the 57 counties, but this is something we invite different players and organizations that are not national but even county level to interrogate and find out how has allocations of health been. As a nation, remember there is a commitment to the Agenda Declaration that 50% and above of the budgets need to be dedicated to the health sector. This has not always been the case, and as a country, we have not reached that threshold. So, in terms of addressing that question that Harriet has mentioned, of course, health sector generally, social sectors have recently taken a back seat, and of course we are seeing the challenges. But even as we look at the health sector specifically, there are issues within the health sector itself. So looking at the managed equipment scheme, this was where the national government was taking and coordinating purchase of equipment for counties. So you find that there has also been a bias towards equipment and such heavy cost aspects in the health sector, but we have forgotten primary healthcare. Within COVID-19, I think most health professionals have mentioned that simple basics like washing hands. So then you ask yourself, how many water points? What is the penetration of the water within our public institutions? Looking even at schools, remember, we have the schools and the program. How many schools have the water? So I think it's time to even revisit some of these programs that as a nation we have documents that we have not breathed life into. So most of the children will not be able to resume school and had to miss some sessions simply because we had not implemented things like the school health program. So I would say that we need to focus more on primary healthcare. Then the allocations to primary healthcare match also with the need to have infrastructure projects and buy machines and issues like that. Of course, there's the issue of the human resources. Looking at the norms and standards for the health sector, you'll find that most of our facilities have not gotten to the level that government itself has put as a standard for our health sector. How many clinical officers are there? How many can we pay for? So these are some of the things that as a country we must look at and try to resource our health facilities better. And in terms of priorities, I think that is what I want to mention for now. But in terms of the leakages, we have also seen that procurement in the health sector is a big issue. Allow me to just mention that procurement will allow us that you can have professionals advise. I do recall that media pointed out that some of the things that are procured were not to the standard that was expected by the health professionals. So it makes us wonder who was sitting in some of these committees that were evaluating some of these things that were done. So for government to demonstrate clean hands in some of these purchases, I would advise that we make use of the health sector professionals, that some of them sit within some of these committees to ensure that if government side lacks the expertise, then they go from players who can at face value see that this material or equipment, as much as it has been bought, is not up to the relevant standard. And lastly, if you allow, is what we have also observed how the unions have kind of gotten a new thing. Within the COVID-19 period, what we found out is the unions were really not just advocating for their welfare, but they went out and expanded their scope to actually point and say there is wastage. We cannot continue looking at clients in an underfunded system. You cannot look at a patient and you cannot give that medicine or you lack the equipment to properly diagnose. So I think as civil society players, I was happy that one of the panelists would have been the union, because their contribution within this period has been very significant and has even pushed us as civil society players to know that we can actually have conversations around accountability with the union, because remember the inside information is what they have as opposed to us as civil society players, and we'll be looking at reports that have been channeled. So I think it's a welcome move, the engagement that we have started having as civil society players together with the media and the unions. Something is done, I don't know how Harriet addresses the concerns is very to face some of the questions. Thank you.
Right, thank you. Thank you. I wish I indeed give us an overview of some of the priorities. You mentioning that there was a lot of focus on infrastructure, yet primary concern, particularly at this time being held, there were serious gaps that were was seen. Maybe when I get back to you, we can also speak to the education sector and how some of these issues that you have highlighted. I had mentioned something about students and how they go back to school, but it's also about infrastructure, how it is able to manage the social distancing, the hand washing, and how, if at all, if you looked at what are some of the responses according to this and whether this has indeed, whether it is sufficient. Next I'll go to you. So at the start of the pandemic, there was, it also happened alongside some time when there was some low-caste inflation, some drought, that people was beginning to be witnessing in the Eastern counties. And I can imagine looking at what Oxford does, there was this entire humanitarian delivery system that was set up. Maybe just talk about briefly about how the COVID-19 pandemic affected humanitarian responses in the Assad counties, and maybe some ideas of what are some of the ways can reduce the severity of humanitarian crisis in these Assad communities.
Sure. Thank you, Harriet, and I hope everyone can hear me. Thanks again for inviting us into this background discussion. My apologies, I actually didn't hear the last question, so I didn't even introduce Oxfam properly, so allow me to do that now. So Oxfam in Kenya is a development humanitarian campaigning organization. We work with a variety of local partners to alleviate poverty and inequality. As far as our mission statement, we envision to transform Kenyan society in which all individuals, regardless of gender, religion, ethnicity, or social standing, are able to access basic services and processes that affect their lives. So, to respond to your question, Harriet, you're right that the COVID-19 pandemic struck at a time that there were a lot of other things going on. What we're now calling the triple threat of crises, including the locusts that affected mostly the northern counties, or what we call arid and semi-arid lands. And also, those counties are also where some of the poorest Kenyans live, some of the most marginalized Kenyans, and have also been affected by recurring droughts and flooding that has been increasing in severity. So, just to give you some some context, by March 2021 this year, we had indications that over 1.4 million individuals, about 10% of the population that we analyzed in those areas, were facing high levels of acute food insecurity. So, obviously, I think what we're seeing is the effect of, as you're saying, COVID-19 and these other crises as well, affecting some of the most marginalized Kenyans. Some of the Kenyans have already been marginalized over the course of some years now. And we've seen some indications that because of the low average rainy seasons starting in March of this year, those food security situations could even deteriorate beyond those numbers. And I know that you asked about the effect of COVID-19 specifically on sort of the humanitarian response in ASAP counties, but I also don't want to understate the effect of COVID-19 on the humanitarian situation in urban, affecting the urban poor, because although we saw a national, I'll give you an example, the national unemployment rate last year, in the second quarter of last year, doubled to 10.4%. But we saw that for households in urban informal settlements, who we also do programming with, unemployment rates actually went up to 36%. So there's a disparity between, obviously, people who live in urban informal settlements and the rest. And these people have also been very severely affected by the COVID-19 pandemic, especially because of how the COVID-19 pandemic has affected urban markets, the informal settlements, residents, and also people who work in the informal sector rely on because they're wage workers. We saw basically an estimated 2 million jobs, 2 million people falling into poverty across the country, and the loss of 900,000 jobs. So obviously this has created a humanitarian situation that affects people's food insecurity and general well-being. We've seen an increase in harmful coping mechanisms that people rely on when the situation deteriorates. And so this just creates a more acute humanitarian situation that requires all of the actors involved to collaborate better to expand the programs that already exist. And in terms of how to reduce the severity of these crises in the future, well, I think we first of all need to understand that as far as the northern counties go, I think we need to understand that climate change is inevitable. And therefore the investment of our time and resources should also be unwavering as a country. I think we need to understand that the North, again, is where some of the most disadvantaged people in our country live. And these communities basically need basic services first and foremost. The government actually has a very strong ending drought emergencies policy framework that donors, NGOs, and the civil sector can help with. But I think what we're recommending is that this needs to be funded more and obviously more transparently in an accountable manner. And basically the funds from the national government I think need to be dispersed with fewer delays. And what we're really seeing is that social protection, I think what we saw last year across the board is that although the Kenyan needs in some ways East Africa to develop social protection programs like the National Renewable Program, these programs really need to be expanded in the long term and also made more transparent and accountable to the people they serve. I think I'll leave it at that. I'm happy to respond to any questions.
Thank you, Levi. Very good insights there. And actually, we often forget about the urban core. We're looking at some of this humanitarian crisis, and of course, we see a lot of impact from COVID. The loss of jobs, as you mentioned, the livelihoods, and definitely affecting the urban core. Anyway, so thank you for putting that into that perspective. I'll hand it over to Abdul. You can hear me?
Yes, I can hear you. So thank you. That was a very, very interesting discussion. But just to do a follow-up question before I invite Mr. Rosette, Mr. Gikandi, I would like to ask, you've demonstrated quite aptly that Kenyans have lost jobs, approximately 2 million plus, according to statistics. But I would like you to share with our very good audience and members of the panel, what is this outstanding problem that Kenyans have faced within the realm of COVID-19? Is it slow response from the government, or because you are one of the few institutions that have been on the ground and you've assessed the public, what is this outstanding problem that Kenyans have faced apart from employment issues amidst COVID-19 pandemic? Thank you.
Sure, I'll try and answer the question if I understand it. I think Kenyans have faced a variety of problems due to COVID-19. There was obviously the primary healthcare concern, which is that I think that the Kenyans, especially that we deal with in urban areas, these are Kenyans in informal settlements, These are the places where it's hard to social distance. In some cases, it's impossible to social distance. These are places where water is sometimes even more expensive to buy in water than it is to buy in Lavington. If you calculate it on how much you purchase each jerrycan versus how much we pay for water in more affluent areas of Nairobi. So even just basic public health practices such as washing your hands and sanitizing obviously become challenges in these places. So there's definitely a public health dimension. And we definitely, we're part of a consortium of organizations that are working to improve water hygiene and sanitation by building, improving water access, working with community-based organizations to pipe water into places that have water challenges, providing soap, things like that. And but I think there are also these secondary effects that have been discussed in the media. One is, for example, is the rise we saw the COVID-19 pandemic also came with a rise in instances of sexual and gender-based violence, just for a variety of reasons. But that also creates a situation that the government and civil sector organizations need to respond to and need to invest more resources into. So I think that there's a variety of challenges that Kenyans are facing from our experience, but also the food security situation is one thing that we're really trying to underscore because one part of the problem is, for example, that we saw a rise in cases of malnutrition for children, young children, and that creates an intergenerational problem because studies show that if children of a certain age don't get proper nutrition, it can have long-term developmental effects, which can affect their ability to alleviate themselves from poverty and the situations that they're in. So we're seeing a kind of multifaceted group of problems, and the disruption of those markets, and just the general economic downturn has really affected people who don't have savings, who don't have assets, who are who work from paycheck to paycheck, and that creates a variety of other problems. It has a multiplier effect in a negative way. I don't know if that answers your question, but I have it does.
Thank you, Mr. Gikandi. I'm very satisfied. Unless the audience have picked something that they will seek clarification later in the next round. I want to thank you so much for those good insights. Now, thank you. So I want to move to a bit notch higher. I would like to engage Mr. Rosette. So I'd like to ask the Transparency International, what are these projects or what assignment have you undertaken to ensure that we have a streamlined anti-corruption policies so that we can create a very good environment and we shun away from the culture of corruption? Because, just a brief explanation, many Kenyans share the same ideological insights that sometimes we have a lot of laws, a lot of policies, but what are we lacking in order to combat corruption? So I'd like to hear from you on this issue.
All right. Thank you so much, Abdul, for that question. I think you answer the question first, and then I start off from where my senior Ms. Irene Chenhat had mentioned. We must realize that for an Article 42, the Constitution, which has been argued to be one of the most progressive constitutions in the world, providing that every person has the right to the health attainable standard of health, which includes the rights to health care services. The reason why I have brought this up is because we have to realize that because we're living in the COVID-19 pandemic, is that the COVID-19 pandemic has exposed cracks, if I might say, in our health system. And we have to realize that for us who are taking out to help, of course, we need financing. But for this financing, the quality of health expenditure largely depends on the integrity that our public procurement largely actually depends on the integrity of our public procurement system. Now, to dive into the question on what TI has done, if I can go to what TI does, TI has been here for quite some time. We have over 20 years of experience in governance work, both at the national and county levels, and that's quite a bit of time fighting this monster that's called corruption. One of the initiatives that we do is we undertake advocacy as our signature approach, and this, of course, is complemented by other approaches such as partnerships development, research, which I will speak to, capacity building, and of course, our engagement with the citizens. In light of that, taking into account the number of years that we have been in this space, we have been involved in numerous transformative anti-corruption initiatives, but specifically to the theme of this conference, of these discussions, some of the various initiatives that we've been undertaking in the health sector quite recently. We've been highly engaged conducting, we've been highly engaged to releasing the statements and the press releases on health governance issues. We also been doing a lot of press appearances to advocate for transparency and accountability. We also highly engaged in public petitions and research. Now, at TI Kenya, we found ourselves in being a think tank of sorts on governance issues and anti-corruption strategies. And our flagship research product, of course, has been the Corruption Perception Index. For those of us who do not know what the Corruption Perception Index is, essentially it offers a snapshot of the relative degree of corruption the working countries and territories all over the globe. It's the leading global indicator of public sector corruption. And I want to say that the war on corruption is not a sprint, but it's quite a very long one. And the reason for this is that there are quite a number of the war on corruption. It has very, very intricacies and complexities which are involved, and especially in the health sector. If you can put it into a perspective, globally, we have estimated around $500 is lost to corruption every year, and almost a third of that is used in the health sector. And the reason why in the health sector is susceptible to corruption is because largely due to the amount of resources and the numerous amount of stakeholders that are involved, the number of actors, the number of systems, the number of fragmentations that we see in the health sector is quite large. Of course, you are aware that corruption seems to be never ending, but there is a light at the end of the time. I'm happy to respond to if I have a question, I will answer the question.
Thank you, Mr. Rosette, for that beautiful insight, quite engaging and thought-provoking. But I would like just to do a follow-up question. We all understand the standards put in place under Article 43 of the Constitution. I hope you can hear me. So, within that breadth of the constitutional provision, there was a suit in court about Article 43 and other economic and social rights about the progressive realization. Would you be kind enough to comment on this issue? Because the common mwananchi, I'd like to use the word, is in the public domain, Wanjiku, is saying that the government is not putting all those proper mechanisms. You remember, if I take you down the memory lane, about the discussion we've had in the Supreme Court of Kenya, when the ex-Chief Justice Willy Mutunga was on the view that we have the full infrastructure. It is only that we lack the implementation mechanism to realize Article 43, which is the discussion we are having. Do you think is the lack of political will, or there are other multi-sectoral hindrances making us not realize Article 43 to its maximum? Thank you.
Yes, and thank you so much for that question. And I think you mentioned part of the problem that we have. Part of the problem that we have, especially in visualization, not only of Article 43, but also other articles that are provided in the Constitution. And we are seeing that it is true that in Kenya we have very good policies, we have very good laws. Like I had mentioned, we have one of the most progressive constitutions in the whole world. But the problem has always been this country, and which was eliminated by Chief Justice Emeritus, was that this country, we have a problem of implementation of the various policies and laws, and also respect for the rule of law. I mean, if I can give an example, in the government's budget, I took for 2021-22 under the Ministry of Health. One of the key performance indicators that has been provided by the Ministry of Health is for the full implementation of the Health Act of 2017. Let me repeat that again. One of the key performance indicators that has been put out, which is going to be implemented by the Ministry of Health, is for a full implementation. Now, that in itself shows the kind of culture that is being faced in this country. Because if that law was implemented in 2017 and the Ministry of Health, one of the key performance indicators is for the full implementation of this law more than 2 years after, that shows the kind of problem that we have. I mean, some of these governance issues and corruption issues that we face, which is reduced our only some of them will be avoided if the various rules and regulations that we have they were respected and upheld. I don't want to get into this, but case in point is Chapter 6, because now that you mentioned our courts, we find that even our courts themselves we shy away from a strict implementation of Chapter 6 of the Constitution. These are some of the challenges, of course, that we face during this space for trying to run advocating for corruption through Kenya. Yeah, so I think pick up more information through the question. I'd love to look at that.
Thank you, Mr. Rosette, for that response. It was quite satisfactory, and I would like to now hand over the floor to my co-moderator, Ms. Harriet. I hope you're on board.
Yes, thank you, Abdul. I don't know if you can hear me. It seems my connection is a bit unstable.
Yes, I can hear you.
I'll come to you, Irene, next. Just to get your insights. We have seen in the recent past, at the beginning of the pandemic last year, we saw government easing off or giving tax rates 5% of the pay. But then towards the end of the year, discussions on reinstating this, and we saw that being reinstated. And over and above that, we have seen government trying to double down the efforts of collecting more taxes for mwananchi that is already down and out from the COVID pandemic, business has been shut down. And most importantly, against a backdrop of a lot of wastage and corruption in the management of already available funds. So how would you situate this government efforts to collect more taxes against a backdrop of corruption and wastage highlighted in the Office of the Auditor General?
Indeed, the revenue authority has been struggling to collect revenue because of our ever-increasing size of the budget. So I think the first problem we have is the way we structure our budget. So you find that a lot of the budget is done from a historic point of view. So what the Ministry of Health got last year was basically that the previous year's allocation. So we've seen a budget that are quite huge, but if you look at the revenue that is expected and projected, that revenue is far behind. So then we have the deficit. Just a minute. I hope you can hear me, Harriet.
Yes, we can.
Sorry for that. So I'll just go back a bit. So indeed, as your question we have stated is past, is government not aligned with the challenges that citizens in this issue right now and how we still seek to collect tax. Indeed, as an institution in the last 3 years, looking at the last year, and eventually then enacted the Finance Act, we have seen new taxes coming in. We have the presumptive tax that thankfully was taken back. Then we have the turnover tax, we have the digital services tax, is the minimum tax. So you find that over and above increasing the rate, government has also started doing to narrow areas that are previously not taxed. Of course, the target of the Development Authority now has been to bring into the net the informal sector. And I think this is in keeping with the nature of our economy, where it's around only 17% of our informal employment and the larger portion in the informal sector. So these new taxes that we seem to seek to bring these other citizens and companies in. But what's we caution is the fact that, of course, being the informal sector, compliance with heavily depend on people's goodwill. So compliance might be an issue, and that then ties with what you mentioned, the wastages that we see. When the wastages, as evidenced by the Auditor General's report, and even by a citizen's own experience with the CFAC services, it would be very difficult for you to tell a mama boga to pay tax that they're not being targeted with, or they do not have water being provided to them, neither have they been which meant they are abandoned in food. So So many of us would say that government is giving the revenue a very tall order, and the revenue authority will collect the tax. But at the point of applying this tax, we really think that a lot of the resources then goes to salaries and allowances of state and public of the staff, which has increased at around 50%. So 50% grow in terms of their salaries and allowances, but in terms of paying tax, and that brings an issue of equity and issues around that. So as we push the informal sector and seek to raise more taxes, what is being given in return? So I would generally say that tax compliance and all of these things, tax morale is greatly. Have you queried what is government's understanding of the universal health? Is it easy to go to a facility and see a doctor? I will be sent for private chemists, I will be sent for private lab to do the test. So I think there is a problem there. But as you have rightly said, the wastages impact negatively on taxpaying morale. And just allow me to go back to the question we put about the tax relief. So we saw government reduce value-added tax, which is good because it then it's a consumer tax, and it would really negatively affect the poor and the marginalized person. So that moves from 14 to 16. We also saw that the pay as you earn again was reduced from 30 to 25. There was a round of strategies that government and steps that government took. But today, some of those strategies are again not in keeping with the nature of our economy. So, I think that was a welcome move. But the data that we use for that is again problematic because the government was relying on previous data and we had people data. But remember, the story that most people lost their jobs. So we already have another number adding up to houses that are being supported with the cash transfer and around that. So I would say that again was not sufficient. But in our analysis, the reason why government had to pull back and really give us a relief for a short time because of government's own bad habits. Remember, our best problem of the country is something that is there. So government did not have the room to use out of that revenue, which went into billions, because they get commitments over the principal and the interest that needs to pay to our lenders. So I would say that as government, as we push government to really look at taxes and reduce them, that is what we're really pushing. As you increase and say you bring more people into the net, then you should be able to say then you reduce the rates. So if you are more people in the net, people time, then what are you doing? And that's against that the background of the audit general report. And lastly, also, I think government is taking the easier way out to increase taxes of the individual resident payments. But remember, we are looking a lot of these financial tools, which might have the corruption important. But are we taxing multinationals in this country? And I think that is the area government is moving when we look at the digital services tax. So again, as an institution, we have to not put a blanket issue and say do not tax. Looking at the current finance bill that is being is open for public participation, we find issues around digital services tax, which is an attempt by government to see that foreign multinationals are not paying their share of tax, while the citizens of Kenya are taking on a heavy burden. So we also encourage government to relook at the illicit financial flows to address the recommendation from the Auditor General's report. And we feel that when we address the corruption from the Auditor General's report and other areas, and then we address the potential revenue areas such as the multinationals, then we will be able not to overtax and not have very draconian finance bills. So I think that would be my response to that, to have government have deeper conversations. Look, and I am happy that we now have, at the African level, we have African revenue authorities trying to see how do we situate ourselves as African countries to ensure that the multinationals and such other countries are not reaping so much out of our countries, while we overtax our citizens, but are not moved. So they really are moved to reduce the tax architecture to ensure that it is in keeping with how technology has shifted. We do not have to have physical presence in our country, but there's a way government can still tax you. So I'll hand it back to you.
Right. Well, thank you. Thank you, Irene, for this great difference, highlighting about the issue that sits, at the core of concerns as citizens, expanding or getting even the common mwananchi to get onto the tax base will not necessarily, which is a strategy for government to get more resources and then not reducing the rates, which compounds issues for mwananchi. And then, of course, the ever-present issue of even those taxes, what are citizens getting out of them? Looking at the state of health, which we saw actually the pandemic exposed a serious issue, put to the climate, an issue of a health system that was really non-existent, and of course really the issue of getting multinationals to pay a fair share of taxes. So I will move on to Levi next, looking at the issues that Irene has highlighted, and maybe just to ask you about the corruption issue, how have they contributed to their allocation of resources at international level, and how does this affect the labor?
Sorry, Harriet, seems to be having some tech challenges. Sure, I'll try and answer from Akmccc's perspective. So I think that corruption and illicit financial flows just undermine county and national efforts to do humanitarian relief programs, to do healthcare in this case. I think that what we've seen from, let's say, a social protection perspective is that we're part of a consortium called the Kenya Cash Consortium that provides cash assistance to affected families and households in both urban and informal settlements, and also in the ASOC counties. And in our urban cash consortium work last year, responding to the COVID-19 pandemic, we were providing people with cash assistance that amounted to 50% of their daily needs, calculated calculated based on their their food needs, medicines, but not including things like rent, and we also accumulating a lot of debts over that period. And we saw that we were, of all the people that we were covering, only 10% were included in the government's national emergency social protection program. And what that indicated to us was that although the government's program was quite expensive, it was covered $1 million last year, it wasn't nearly covering as many people as needed help. And that's a testament both to the scale of the humanitarian crisis, but also to the scarcity and how precious our resources are that go into programs like social protection and healthcare. So I think that illicit financial flows, which in some cases amount to as much as 30% of our operational budgets, can severely undermine efforts to help counties that are in serious need. I think we saw from the CAMSA irregularities last year that even the most frontline, especially the most frontline affected communities and workers and citizens, how they can be affected by this, by these illicit flows and by corruption. Yeah, I think that's how I respond from my perspective.
Right, thank you for that. Indeed, wow, it's quite interesting, to see that a very small percentage of the population is reached by the social protection programs, and of course looking at, and then if you look at the figures that were reported in the media with regards to how much money was lost, and imagine how, if that money had been put to even had contributed to the social protection programs, to how much more would have been helped with that. But just follow up, with there have been fine that there was overlap with what government was doing and what civil society was doing and private sector, looking at community fund. Was there like a consolidated database of the beneficiaries? Were we also in a situation where there was overlap with people benefiting and others, while maybe not others are not done?
That's a great question, Harriet, and I think that so we realized very early on into the response that these collaboration issues would occur because there were so many players in the mix. There was private sector, there was civil sector, there was international NGOs, local NGOs, the government was involved in different levels of aid and cash assistance. And so, led by the government, there had been a variety of working groups that have been established to streamline that collaboration. And I think it's improved over time. And I think, we learned to collaborate better over time. And I'll give you an example. So, Oxfam, the Urban Cash Consortium we were part of, we calculated that we would cover 50% of people's minimum expenditure basket. That's just, it's a term that's used to describe how much people would spend on basic needs for a household. And this is calculated based on market prices at the time. And so we would cover 50% of that. And we were sending people around between 4,000 and 6,000 shillings. And what we would do is, if the people who we registered into our program were already covered under the national social protection program, then we would top them up. Instead of giving them the whole amount, we would just top them up to reach that 50%. And if they were not covered by the national program, then we would give them the entire amount to get to that 50% level. And yeah, so I think that the collaboration definitely improved over time, although there were risks of people being, our efforts not being aligned in such a way that we would just reach the most amount of people possible. But I think we do better over time.
All right, thank you for that. Abdul, you can hear me, back to you.
Yes, so thank you, Ms. Harriet, for that round of question. So I would like to raise a question to Mr. Rosette. I hope he's on board. I would like to know what are the assignments that Transparency International have undertaken to combat corruption in the healthcare sector? And if yes, then kindly highlight the challenges that you face while addressing the rate of corruption or the index in corruption in the healthcare sector. Yes, Mr. Rosette.
Yes. Thank you for that question. To answer your question, I will go back to my earlier sentiment where I had mentioned that the role of corruption it's not disputes. it's a very, very, very long marathon. And of course, this is due to the various complexities involved and the various actors and stakeholders that have been involved in the fight against corruption. More specifically, the health sector. The health sector, not just in Kenya, but in other jurisdictions as well. The health sector is one of the sectors where we get, rather, in country budgets during the budgetary processes. The health sector is among the top sectors which get the lion's share. And also, like I have mentioned, in the health sector, there is a lot of stakeholders and actors who are involved, and also, like the COVID-19 pandemic has shown us, the globalized nature of the supply chain for essentially health products and technologies. So it becomes quite a challenge navigating that sea of corruption in the health sector. That notwithstanding, like I have said, Transparency International Kenya as an institution was backed more than 20 years ago, and we have tried our best and also played our part in fighting corruption in the health sector. And someone, like I have also mentioned, Transparency International use advocacy as a signature approach. And it's from that we have been engaged in a lot of advocacy initiatives. Additionally, Transparency International Kenya will also be playing a part in fighting corruption in the health sector through public expenditure and financial accountability tracking and monitoring. For example, we have COVID-19 expenditure tracking tool. Additionally, as an institution, we have been integrating anti-corruption outreaches, just basically to wider efforts to strengthen health systems both at the national level and county level. And one of the methods in which we have done this is the corruption risk analysis, and the one that I have mentioned. For example, the corruption perception index, which we want to improve. The function of such analysis, they can be used by the various actors, in this case the government, to prioritize which corruption risks to address so that they at least know they can use or rather seal some of these corruption loopholes that we've been witnessing. Transparency International as an institution also, we've also been engaged quite a lot in citizen rather civic participation for oversight. And the main ways in which this has been done is through the conducting of social audits and citizen scorecards. In this instance, in the health service delivery, and also through various partnerships, such as the Office of the Auditor General, other civil societies, such as National Taxpayer Association, essentially push for the transparency and accountability in the health sector. Transparency is as an institution also, we've been highly engaged in the development of health policy. Of course, this is both at the national and county level, and one of the main mediums in which we do this is through the submission of memoranda in contribution of other disagreed health policies and acts. Also, we've also been highly engaged in the development of policies to inform basically changes in health service delivery. Of course, there are challenges. One such challenge, which I can mention, political will is very, very key to tackle corruption in any sector, not just in the health sector. But sometimes counting on it only is quite challenging, as my panelists can also attest to. This is because, like I have mentioned, the health sector, it involves quite a lot of players, and some of these players who might be inclined politically, they are under certain political and bureaucratic pressure to deliver, and also to turn a blind eye. That is, of course, that one is quite a challenge. Of course, and also, even for corruption, like I have also mentioned, we have very, very good laws and policies which provide for sanctions against such corrupt practices. But corruption exists. It's very difficult. A very good example that I can give, which is of course in the public domain, is in regards to this scandal that you've seen, the cancer scandal. It's in the public. For example, I can remember that there was this lady who was saying that she prayed for COVID-19 contract. She was aware of that contract in the public domain, but all this information is in the public domain, but yet we were yet to see very tangible action in regards to it. The Auditor General herself, through various through two bodies, has highlighted the various malpractices that we have witnessed during this COVID-19 pandemic, but yet we are yet to see any tangible action from those reports and also from the various investigations. But that does not mean that the anti-corruption strategies that they are not working. It's just that it's a bit more difficult and challenging, and a lot goes behind the scenes, such that now we find that it might seem as if you're not really the word is corruption, but that is just not the case. It's just that it's a bit more complex, and especially in the health sector, it involves quite a number of things. Over to you.
Thank you, Mr. Rosette, for that very, very good insight. Just a follow-up question, which will be my last, and I will hand over to Ms. Harriet so that she can take us through the audience. I'm sure our audience want to ask a lot of questions. We need to give them an opportunity to ask this question. So I would like to ask you, Mr. Rosette, very kindly. I've read a report. I read a report done by Transparency International, quite intense in terms of the content and the issues that have been raised. One of the last recommendations with regard to some scandals that have happened at the national and county level was that we need a publishing mechanism of these contracts so that Kenyans, the common man, the common woman, the Wanjiku, could access these contracts, however complex they are, but the aspect of transparency is key, and which underlies one of the good values in the Constitution. So my question would be, are we having a problem in the procurement? Because one of the issues raised was direct procurement in the report. So would you suggest another mechanism whereby we could elevate the level of transparency to combat corruption completely to its 0% in the public sector specifically? Thank you.
Thank you, Abdul, for that very, very good question. And I'll try to answer it where I understood the question. My insight into your question would be that if I can take you back to our earlier discussion, where I had said that the problem that you have, it's quite a very big problem, is the implementation of respect for the rule of law. To pick up from where you mentioned on the publishing of contracts, and when I say the publishing of contracts, I don't mean the numbers of contracts. We already have in place a mechanism for the publishing of contracts by public entities. And this has been given effect by Executive Order No. 2 of 2018. Of course, in Article 27 of the Constitution, as read together with Article 10 of the Constitution of Kenya, which provides for the principles of good governance. More specifically, Article 30, which has the right of governance, integrity, transparency, and accountability. Now, the problem that we have is that we have public entities that our public entities, rather, let me rephrase it. Our public entities are not publishing procurement information as per Executive Order No. 2 of 2018. And of course, this is due to various reasons. Some public entities have stated that they have not published because they cite that understanding, rather due to lack of capacity, that they are not able to publish. Allow me to say that the public, where public entities are required to publish the procurement information in the public procurement information portal, that is the PCIP, which is managed by the Public Procurement and Regulatory Authority. And in the future, of course, we want to see more public entities publishing because I understand that the PPRA has published a new system, and of course now with the publishing of the new system, they are going to be undertaking capacity building, various capacity building initiatives, at least now to for more public entities to be able to publish their procurement information. Of course, the advantages in publishing procurement information. That's why I say we've actually doing it. Of course, there's more to be done, but in terms of regulations and our procurement rules, they are quite extensive in the list, but they are not being fully implemented to the letter. Before we even start thinking about having additional policies or having additional laws, let us first of all deal with what we have, and let us first of all fully implement what is present, so that at least now we can conduct an audit. Maybe after 2 years, ask ourselves, we have fully implemented these laws, for example, these are the procurement laws. These are the risks that you identified. These are the challenges that you identified. Should we now implement or rather enact another law or revise the current laws? Such kind of things. But we cannot start thinking about adding additional policies into what we already have without fully addressing and implementing the current structures that we have. Over to you, Abdul. I hope that answered the question.
Thank you, Mr. Rosette, for that good insight. I would like to appreciate your expertise, your practical aspect of viewing the law and the commonality in terms of the problems we face in implementing it and gearing towards good resolution. So now, since we are approaching the very peak of our session, I would like to hand over, seek the floor to Ms. Harriet so that she can spearhead the session on Q&A from our audience. And in case we'll have questions, we answer, then we do the last round as we finalize this good session. So over to you, Ms. Harriet, my co-moderator.
One of the partners to look for written response, so I allow them to make communications before we open it up for questions. But you're encouraged to put your questions on the chat box, so we are able to get into them quickly. So, Levi, I'll come to you and ask about, you've had discussions on the issues that are affecting the humanitarian crisis, which you mentioned is a triple threat. And of course, COVID being the one that's the forefront of this discussion. Just coming back to your work at Oxford, guys, what are some of the issues that you wrote about that would really the severity of humanitarian crisis to communities, because they are poor and communities in the Assam region?
7.8 trillion, accounting for 69% of our GDP by 2030. And these corruption scandals, each year actually, and this is actually from Transparency International report, robbed us of an estimated 2017 billion shillings. And that's nearly 3 times our national healthcare budget, and it was 6 times the national social protection budget of 2018 to 2019. So, and also just to put a bit more context, because 32% of the total health expenditure can come straight from people's pockets at the time of need, what we're primarily advocating for is that we need to tailor a greater proportion of funds and policies touching vulnerable populations, especially for the workers, especially for the settlements, and then the people in the north in these counties that just face all these other issues. The African Union social policy framework recommends that we spend at least 2% of our national budget, or 4.5% of our GDP, on social protection. And as far as 2018, we were spending just 0.4% of our GDP on social protection. And given that our debt is currently ballooning, and as my colleagues pointed out, these domestic resource mobilization inequalities and challenges in our tax policies have a direct impact on our ability to protect the most vulnerable. We definitely looking for an alignment of those policies to support more social relief programs. We also need to recognize that social protection is a human right. It's enshrined in the Declaration of Human Rights, and also it's Article 43 of our Constitution. And we need to recognize that Kenya is needed in some ways regionally in our hunger safety program, in our immigrant national social protection program. So we need to continue leading by example and invest in all of these programs. As we do so, we obviously need to keep in mind that transparency and accountability are very important. And so what we recommend is that we build a national transparency feedback and complaint mechanism to make these social protection programs as accountable as possible, especially to the people that they serve. We, in the north, and especially these climate change, these counties that are defined in climate change, we're recommending that we need to invest a lot in preparedness. And this also actually affects urban areas before, but we need to encourage and fund more coordinated early warning and early action mechanisms to ensure that governments can routinely assess informal settlements and other areas that are at risk. And so routinely assess them for livelihood risks and help mitigate and respond quickly to these either slow onset emergencies or large emergencies like the COVID-19 pandemic. And I think because this is a whole society effort, because we were all involved in this last year, all sectors of society stepped into the relief effort. We definitely need to strengthen and improve the coordination and sharing of information between government, civil society, UN, NGOs, to maximize efficiency, speed, and make sure we're not creating benefits. And as you mentioned, Harriet, the need for this national data set of vulnerable people is very strong. We need robust data at county level and national level to know who's at risk, who is likely to fall into risk in these crises, so we can respond quickly and target them accurately. As we've seen, even the registration of these programs can take time and affects people. I think I'll leave it at that. That's quite a few recommendations. And thank you again for inviting us to be part of this.
Thank you, everyone, for that. And very succinct recommendations. looking to investing in fairness in agro systems, investing more in social protection programs, embedding transparency and accountability mechanisms, strengthening coordination, and definitely make recommendations, and we can put together a team of competition that share performance. So that I think makes it possible. Thank you so much for being part of this work, and I think I'll go over to my room, and thank you, keeping me here to I read in terms of recommendations, we've had discussions on taxes, how to the need for taxes, definitely, but then how do we safeguard our taxes? What recommendations would you make to government that can safeguard our taxes, particularly go into improving the management and response of COVID-19, because that seems to be what we're doing as a country.
I can hear you, and thanks for the questions. So, I'm looking at recommendation in terms of efficiency management of our taxes. If we want, I think we really need to better undertake the public participation, because that's where we get the view. I think the public participation has been heavily leading towards the expenditure. So we have the money, how are we going to use it? So it's just thinking of the project where we are going the money. But we also need similar and more rigorous public participation around how we use that revenue. Is it poor? So I think that is one area of what I'm strongly in the government that the poor taxation. And I'm happy that they still continue and still more that can be done. So just the public participation around it. The period is not too short. So it's more avenues and with the COVID-19 period, the public participation has been really impacted because you can't do the numbers as much. But I'm happy that we're also using technology. So poor taxation and more public participation around the revenue side of raising taxes. Then of course the taxes have come in. Our recommendation there is that when you procure and you want to apply these taxes for a specific sector, later with the government taking expert advice, you cannot procure health-related materials without having a health sector specialist assisting in that procurement in that services. So let us not be very rigid. If the law allows it, it does expand some to do some of these stakeholders who are key, and it ensures that we get value for money. Because we're just not procuring for the sake, because resources are always limited. So how the resources are accumulated to ensure we get more and better value for the citizens. In terms also of how we, because we're talking about COVID-19, and this is just one of those kind of pandemic disaster, when climate change and the like, know that a lot of some of these things will come up. So how are we improving intergovernmental relations? So are we still having our subnational and national laws, or where is it that we can put some of these interests down and say that we must look out for Kenyan citizens, and we must, because remember the response for COVID-19 was a bit delayed at the start because there was that question. A national is taking or is encroaching on the county level mandate. So this can be very clearly addressed so that in case we need to respond more and faster to such pandemics or issues like that, we really don't have to waste a lot of time on that. And over and above, I think we also learned that we must invest in public services. So how do we strike our key recommendation that we must strike a balance between the social sector and ensure that these are resources. We agree infrastructure is important, but how also do we take care of the social sectors? And I think just speaking to what Oxfam representative has mentioned, we must take care of the marginalized amount. So we have seen that the amount that we give and looking at the cost of even running out our household. So there's a question also how much are we giving? And if we are giving 2,000 per month to our household, and we remember that public services are always non-existent in some areas. So is this 2,000 will take care of healthcare? Is this 2,000 will take care of education for families? So we must review the amount. So a recommendation that we must expand the number of people that we are giving, say, cash transfer or the social safety net. So expand the number and also the amount that we are giving. Of course, this would have a budgetary implication. And again, we find that the government will say we increase the taxes, and we encourage that as opposed to increasing the taxes, we just reduce the areas of wastage and increase efficiency and we'll be able to cover more payers. So those are my recommendations on how we can better our current management of the COVID-19 situation and even take on lessons that in case such or other types of disasters before Kenya, the rate of response and the quality of that response will be better than what we have already seen in this country.
Yes, Miss Irene, I've received, sorry, not Miss Irene, Harriet, I've received two questions from the audience. One, I think, divide them. One says, it is the responsibility of the state to show the resources are not available and prioritize widest enjoyment of these rights. In Kenya, resources are available, but a majority of the population still fail to enjoy their right to health. What's your comment on availability of resources to provide or to attain the highest attainable standards of health? So this is the first question. Sorry. The second question, I would invite Miss Irene, because this is resource-based and she's been dealing with tax. I'd like her to answer this. So the second question, the right to healthcare is featured prominently in the local and international laws. Kenya, these provisions have largely remained normative expressions. They in fact can be described as stillborn legal norms. How can we address this in the future? So this one I'll invite Mr. Rosette to answer on behalf of the person who posed this question. So over to you, Ms. Irene.
I think this points a network problem, and I'm really not taking the question. Let me try to say what I've had in confirm the last week. So you mentioned that a lot of citizens are saying they are not accessing healthcare, which is enshrined in the Constitution. So is that a good?
Yes, precisely. It is.
Okay, thank you. Indeed, I think, and remember that looking at the Constitution 2010, it's one of those articles that say we've never had the social economic rights within the Constitution. I think people know that the political rights. So this was a push by civil society players and the citizens generally. And I would think that the government either had not fully put, and they really did to ensure that this is there. Because remember the Constitution itself says progressive realization of this right. So our government will be able to say that we have done what we can within the budget that we can afford. Of course, it's something that we can test because we already see a lot of wastage. So with that level of wastage, we cannot say that we cannot provide this right to the people, or according to you, what you aggressively giving this right. So I think the way the Constitution needs to do, carrying what we think is citizens in terms of healthcare would have been better. We can really change the way we look at the country. Within my presentation over the last 2 or 3 questions, we've already mentioned if we quantify what is being lost in terms of corruption, we already get resources that are provided. If you look at funds that are going to needs that are not priorities, because health is obviously a priority across the country. So if we are prioritizing other things, so what is the opportunity cost? So that's another area that we need to note. Some of the huge mega projects that are taking a lot of the resources are these needs that were collectively identified by Kenyans within the budget documents such as the county integrated development plan and some of these documents. And lastly, as I mentioned, there are areas of potential revenue that government has still not taken on board because of the framing of our tax legislation. So the framing of the tax legislation is far behind the reality that we have and the way technology has shifted the taxing landscape. So how fast are our tax laws embracing and ensuring that we are not losing potential revenue? So those 3 areas for me can be demonstrated as areas that the government can then use to ensure that health services are provided better, so that even when our constitution says to address it is not viewed as a lacuna, and so we say, hey, we are providing. So there first must be political goodwill, which I feel is missing, and fundamentally so because healthcare, we know, as a result of even devolution, has been very contested. So I think we have also lost in terms of what we are providing to citizens because of the push and pull between which level of government to provide. Of course, there's been a push to retain a significant part of healthcare provision to national level because of the funds that are attached to it. So if we can then address these 4 areas that I've mentioned, I'm sure the provision of health services will improve. So I would encourage all of us here, including us as civil society organizations, to push harder on this. I really the ones who do a lot of public investigation. Have we moved to court to understand what does progressive the organization mean? Is it a blanket safety measure for government to do what within our context? Already we have a budget deficit. There's A and B we cannot provide for our citizens. Or is there evidence we can push or compare and tell governments, okay, these are potential areas that we need to now that we help you provide this much needed service to our people that are anyway already doing to provide for that. Thank you. I hope that answers something.
Thank you, Ms. Irene, for that insight. It's a very satisfactory response. Now, just do a recap of the second question, which was directed to Mr. Rosette. The right to health care is featured prominently in the local and international laws. In Kenya, these provisions have largely remained normative expressions. They, in fact, can be described as stillborn legal norms. How can we address this in the future?
Thank you, Abdul, for that question, and also thank you to the participant who posed that question. My understanding of that question, I will pick up from where my friends left off on progressive realization, because I believe this falls on Article 32. Article 32 on the right to health. Now, the issue here is the progressive realization of all social and economic rights. Because the problem that is there, in my opinion, which has been caused, rather which has been expressly provided in the Constitution, I believe it's under Article 21, forgive me if I'm wrong, where it provides that the state shall take legislative and policy measures to achieve the progressive realization this one has also been adjudicated in our courts, is on a progressive realization of these rights. Because when the promulgation of the Constitution of Kenya in 2010, from the spirit and the letter of the Constitution, was that some rights, rather it is provided for the Bill of Rights. Of course, this is one of the reasons why the Constitution has been stated to be one of the most progressive constitutions, and through that, of course, providing for, rather, if I might rephrase it, Article 21. It made the progressive realization of these social and economic rights, where the right to health is called under as a justiciable right. Now the problem that comes with that is that when you provide for social and economic rights, justiciable rights, what that means is that now the state is under an obligation to provide in the shortest time possible for the progressive realization of this right. And this has been, of course, subject to various interpretation by our courts. And the one that I can think of was in the Michigan case in the High Court, where the court stated that the argument for social and economic rights is that the government, because the government were arguing that there is no timeline to progressive realization, and of course this is subject to correction because it's been a while since I read that case. But if I remember it correctly, the court stated that the government had a dismissive approach to the social and economic rights more than Article 43, because the government were arguing that there is no timeline for the progressive realization of this SERs, that is social and economic rights. Now the problem that what the court stated in that case was that the state must begin to take steps towards the realization of this right, and that is one of the reasons why I really have a problem with some of the interpretation, some of the interpretation of some of the judgments that our courts have released, because now when the court states that the state must begin to take steps, that does not provide a specific timeline on when the court is supposed to take steps. So I think the issue of social and economic rights and the progressive realization of these rights is something that is quite challenging in its nature and also subjective interpretation. And my opinion on that is that perhaps maybe for our courts, because it is our courts intertwined with especially the high courts, to address some of these challenges, to provide maybe now for a specific timeline and maybe harsher sanctions maybe to government, or especially not to government. government for the progressive realization of these rights. But then again, this boils down to the respect for the rule of law and implementation of various laws and policies and respect for court judgments. Over to you, I think I will leave it at that. Because the issue of achieving both social and economic rights, which I do not have a definite answer to that at the moment.
Thank you, Mr. Rosette, for that very, very good response. So I'd like to say that we have reached the very, very end, the tail end of this discussion. From my end, I would just like to thank everyone, production team, and anybody who has contributed to keep this program aired live. So in essence, it's a very, very insightful discussion. Someone said, or I read somewhere, that corruption is a disease. And the best vaccine to this disease is transparency. We have a constitutional order. We have a rigid constitutional architect from Chapter 6 to Chapter 4, Bill on Human Rights. All those are embedded in our constitution. So it is our primary obligation as Kenyans, as very good citizens, responsible ones. We pay tax on time. We abort corruption. We shun corruption. We try to run away from any corrupt practices. So thank you to my panelists. My co-moderator will give her final remarks. And I want to say thank you all. God bless you. It has been really an insightful, thought-provoking discussion. We've gone home, or we are going home with a lot of insights from our panelists. Thank you. Over to you, Ms. Harriet Wachira. Thank you.
Thank you, well back the technical challenges, but asanteni sana for to our panelists from NTA, from Oxfam, and from TIA for the great insights. I believe had very great information identifying what the issues are and even the recommendations that we have provided to governments and civil society that will definitely go into improving the country. So without further ado, bring this session to a close. To join us tomorrow. The session is slated tomorrow to continue the discussion. Asanteni sana and have a great head. Thank you.
For the past 8 years, the All Kenyan Moot Court competition has been keen on pushing the conversation on human rights within the Kenyan context. Through conducting various moot court competitions centered around human rights issues happening in Kenya, we've been able to engage with various stakeholders and, most importantly, law students from across the various universities countrywide to steer human rights discussions among students. This year will not be any different. Even with the COVID-19 pandemic that has changed what would be the old order to what is the new normal, we will hold our conference and moot court competitions to push the conversation around health and corruption, with a key focus on the Article 43 right, its realization, government response to the COVID-19 pandemic, and the malignant cancer of corruption that has over the years crippled the Kenyan healthcare sector. Join us virtually from the 2nd to the 5th of June 2021 as we discuss the theme, Combating Corruption in the Attainment of the Highest Attainable Standard of Health.